So here we are in our second chapter in the circulatory system. In this chapter, we'll be addressing everything about the heart. We're going to look at the cardiovascular system in general, the gross anatomy of the heart, that is, the physical features we can see, as well as the cardiac conduction system and how cardiac muscle works, the electrical and contractile activity of the heart, as well as blood flow, heart sounds, and the cardiac cycle. At the end, we'll consider cardiac output. Cardiology is the study of the heart and treatment of its disorders. There's a broad history of cardiology, beginning with Chinese, Egyptian, Greek, and Roman scholars, most of whom surmised that the heart is a pump for filling the vessels. However, Aristotle had some different views, that the heart was really the seat of emotion. It took a long time to break these views. Kind of amazing to think that in the early decades of the 20th century, very little could be recommended for heart disease other than bed rest. And then nitroglycerin came around, and that improved coronary circulation. It's quite impressive to look today and see all the options available. Coronary bypass surgery, replacement of diseased valves, clot-dissolving enzymes, heart transplants, artificial pacemakers, valves, and hearts have made cardiology one of the most dramatic and attention-getting fields of science. The cardiovascular system itself involves the heart and the blood vessels. The circulatory system is the heart, blood vessels, and the blood. The major divisions of the circulatory system are the pulmonary circuit and the systemic circuit. The pulmonary circuit involves the right side of the heart and cycles blood through the lungs to pick up oxygenated air and back to the heart. The systemic circuit is the left side of the heart. This side supplies oxygenated blood to all of the tissues of the body and then returns to the heart. The left side of the heart carries fully oxygenated blood that arrives from the lungs via the pulmonary veins. The blood here is sent to all the organs out through the aorta, this big red vessel here. The right side of the heart has lesser oxygenated blood, which arrives from the inferior and superior vena cavas, where it's pumped out through the pulmonary trunk into the lungs. So as you'll recall, the heart is located in the mediastinum, which is a membranous pouch that's located between the lungs. It's described as having a base and an apex. And this is a little bit misleading because the base is at the top and the apex is at the bottom, but it's based on the shape. The base is the wide portion of the heart. It's superior, and most of the blood vessels attach here. The apex is the inferior end, and it tilts slightly to the left and tapers to a point here. The heart's about 3.5 inches wide at the base and about 5 inches from base to apex, and about 2.5 inches in anterior-posterior dimensions. It only weighs about 10 ounces if it's healthy. It's about the size of your fist if you place that right in the middle of your chest. The thumb side up would be the base of the heart, and the apex moves over to the left, of course, if you're using your left hand. Here's some more figures to illustrate the heart's position. You can see clearly here in this transverse section that the heart occupies space more in the left side of the chest cavity. Remember, the pericardium is this double-walled sac, or the pericardial sac that encloses the heart. This allows the heart to beat without causing any friction on the surrounding lungs. It provides room to expand, yet resist excessive expansion. It's anchored to the diaphragm inferiorly and the sternum anteriorly. The parietal pericardium, that is the outer wall of the pericardial sac, has a superficial fibrous layer of connective tissue and then a deep, thin serous layer that secretes the serous fluid. The visceral pericardium, or the epicardium, is the covering on the heart itself. The serous lining of the sac turns inward at the base of the heart to cover the heart's surface. Remember, as if you're pushing an apple down into a balloon that's in a container. The pericardial cavity, again, is the space here between those two layers. It's usually filled with about 5 to 30 milliliters of pericardial fluid, which acts to allow slipperage between the membranes, as well as creating a protective layer around the heart. Pericarditis is the inflammation of these membranes, and it's quite painful with each heartbeat because there's friction between these membranes. These are pictures of cadaver hearts, real human hearts from deceased individuals. Here we are from the outside looking at the base and the apex. We can see this interventricular sulcus between the two sides of the heart. Once we bisect the heart by creating a frontal section, we can see a lot of the internal anatomy. We'll be spending some time dissecting sheep hearts in lab.